Our brains rely on a continual flow of oxygen carried in the blood to function properly. When this blood flow is temporarily reduced, you may feel dizzy, nauseous, or just odd, and if it's reduced long enough, you may feel faint. Fainting is a short-term loss of consciousness, and some people are more prone to fainting than others. There are many potential reasons why someone might faint, including anxiety, hunger, pregnancy, stress, tiredness, pain, overheating, or prolonged periods of standing still or standing up. These situations can cause blood to pool in the legs, reducing the amount of blood reaching the brain. If someone feels faint, help them to lay down immediately to restore the blood flow to the brain. It's not advisable to sit them down, as fainting while leaning forward can lead to falls and further injury. Opening a window to allow fresh air in can also aid recovery indoors. If someone has fainted, lay them on their back and raise their legs by about 30 centimeters. Support their legs using your shoulders or an object like a box or a bag. This position improves blood flow to the brain, usually leading to a quick recovery. As they regain consciousness, calmly explain to them what's happened, as they may be confused or disorientated. When they feel stable, assist them in getting up slowly to prevent another fainting episode. If they feel faint again, have them lay down and raise their legs until recovered. If the person does not quickly regain consciousness, open their airway and check for breathing. Follow the standard procedures for treating an unconscious casualty if they are not breathing. Generally, it's unnecessary to call the emergency services unless the person has injured themselves in the fall or they don't regain consciousness. However, it may be prudent to call a family member or friend to escort them home. For those in the late stages of pregnancy, it's advisable to lie on their left side, as this position helps prevent the restriction of blood flow back to the heart. Regular fainting spells may indicate an underlying health concern, so frequent episodes should prompt a visit to the doctors. If fainting occurs during exercise or is followed by a seizure, you should always alert the emergency medical services. Understanding these guidelines for managing fainting can help ensure prompt and effective care, minimizing the risk of injury and facilitating a quick recovery.